Governor Mary Fallin has announced that the federal government will allow Oklahoma to extend its Insure Oklahoma program for another year. The program serves low-income working Oklahomans. Fallin's administration applied to use the program in lieu of extending Medicaid as per the Affordable Care Act. That request was denied, though the door was left open for negotiations.
This is a great victory, a great win for the people of Oklahoma to be able to continue the Insure Oklahoma program itself. And I appreciate the administration working with our state. I think this is a wonderful model that has worked well for our fellow Oklahomans and our small businesses. It is a model that would be great for other states to even look at and consider. Now, my hope moving forward is that once our one-year extension is over, that the administration will continue to see that this is a successful program and hopefully consider allowing us to keep our Insure Oklahoma program, and I've expressed that to them.
And right now, our one-year extension goes from January 1 of 2014 to December 31st of 2014. So we got that one-year extension. Basically, we have a lot of people that qualify for Insure Oklahoma that don't participate. So I'm not expecting us to reach that capacity. So I'm not sure exactly how many people are going to get left out.
The announcement of the deal to extend Insure Oklahoma comes just over 3 weeks before people can begin signing up for the health insurance exchange authorized under the Federal Affordable Care Act. Oklahoma Watch has been following that story. I spoke with Oklahoma Watch reporter Warren Vieth about the upcoming changes in access to health care through state and federal programs. Warren, what does the extension of Insure Oklahoma mean?
Well, it's great news for about 30,000 people who would have lost their insurance at the end of the year or been forced to move from that program into the big healthcare marketplace that's being set up under Obamacare. For about 9,000 of them, it's a lifesaver because those people would have fallen into the so-called coverage crater where they didn't make enough money to participate in the health exchange, and they would have lost the subsidized insurance that they already have.
So this doesn't affect everyone the same way?
No, it doesn't. For about 2/3 of those people, they'll just keep the insurance they've already got. For about 8,000 people, they're going to be moved out of Insure Oklahoma and into the federal health care marketplace that begins on October 1.
How does Insure Oklahoma work?
It's a program that uses a combination of state money, federal money, employee contributions, and if their employer is participating, employer contributions to purchase health care. It means that people can get health care at a much lower cost than if they were paying for it themselves.
Why was it going to expire at the end of the year?
Because the federal government changed the ground rules a little bit, and the state government declined to go along with those changes.
So, the fact that the federal government is going to allow Oklahoma now to extend Insure Oklahoma, does that suggest that the state is going to go along with some federal regulations that were the sticking points earlier?
It's not immediately clear, but this whole thing is kind of an evolving, rapidly evolving situation where it could be that Insure Oklahoma evolves into a different kind of program, sort of what the governor has referred to as an Oklahoma plan that would serve as an alternative to the Obamacare programs.
You mentioned sign up begins on October 1st.
This is for the big health care marketplace that is being set up under the Affordable Care Act. This is going to apply to roughly 1 out of 10 Oklahomans, nearly 400,000 people. Many of those people don't know that they're affected by it, or they don't know exactly how it works. And there's a real information vacuum out there that somebody needs to fill.
So why is there a vacuum?
In part because the state of Oklahoma, the elected officials in Oklahoma, don't want to have anything to do with Obamacare if they can keep from it, so they have decided not to serve as information providers for that. Partly, though, I think it's because there's just been so much public antipathy toward Obamacare that people have focused on the big forest and not really looked at some of the individual trees that might affect them personally.
What has the Department of Health and Human Services been doing to get word out about the exchanges in the marketplace?
The federal government, through HHS, has set up a website, www.healthcare.gov. That's the primary portal point for people to find out how this whole thing works. And meanwhile, they have awarded some grant money in Oklahoma and other states so people can try to disseminate information on the ground.
So will people be able to get information going forward, possibly even more now?
Yes, it's available now on that website. What happens on October 1 is that people can actually apply for insurance for the first time. Again, there are 400,000 people in this state who will qualify to get insurance through that program. This is not government insurance, it's private market plans, but they'll be listed on this website.
Oklahoma Watch has a community forum coming up concerning healthcare. Tell us about that.
On Tuesday, September 24th, 6 p.m. at Camps 1910 Cafe in Oklahoma City, we will have a forum where we try to provide answers about what the federal healthcare marketplace is. We're going to have a couple guests. We're still finalizing those arrangements. Whether people love Obamacare or hate Obamacare, it doesn't matter. We're just trying to explain what this thing is, how it works, who can participate, and whether it might make sense.
Warren Vieth from Oklahoma Watch, thank you.
Thank you.